Wow, that's a lot to take in, and that's just a snapshot of what takes place at Montage Health every day. Some of what you saw is what one would expect. We take care of you when you're sick. But more and more of what we do is unexpected, because when it comes to healthcare, we need to think differently. I'd like to start with a quick story. Some of you may have heard this story before. In the public health circles, this is referred to as the parable. They refer to this parable as the river story. A man and a woman were fishing in a fast-moving stream when, as they were fishing, they noticed someone floating down the river, struggling to stay afloat. They waded out, brought the person to the edge of the river, and assisted them when they saw a second person floating down the river. They rushed in again, helped that person to the shore as well. A third, a fourth, and a fifth person were floating down the river. And each person they waded in and assisted to the shore. Exhausted, the woman finally suggested that one of them should go upstream and see what was happening. And there it was. A bridge had broken and people were falling in. If the bridge could simply be fixed, then people would be prevented from falling in and be saved from drowning. For us, the downstream in that story is community hospital, the life-saving and life-giving place that people have counted on for decades. The place where people go to have their babies, have a knee replaced, receive a new heart valve, have their stroke treated, or their cancer treated. The upstream is what we've been building for the last decade, a metaphorical, strong, and solid bridge to keep people from falling in. The bridge is made of many things that are expected and more unexpected as well. Take Thomas Muir. It's common for healthcare systems to have social workers, but what Thomas does is not so common. You see, on most days, Thomas's office is the streets of Monterey, and in particular, where the homeless gather. When having enough to eat and a warm place to sleep are daily uncertainties, thinking about your health care is not a top priority. And that's where Thomas comes in. He works with our homeless and meets them where they are. He told me the story of a woman he worked with this past year who'd fallen on hard times. Her fiancé had died unexpectedly, sending her into a downward spiral of alcoholism, drug abuse, and homelessness. The police department and paramedics were dispatched to assist her 130 times in the course of 1 year. She visited our emergency department 47 times in the course of a year. And in the course, she accumulated in excess of $300,000 in unpaid medical bills. Thomas worked with her over several months, and after gaining her trust, she agreed to enter rehabilitation for treatment and counseling. That person's now been sober for over 6 months. She's working, and she's back in college. When Thomas helps someone, one of our neighbors, he is in fact indirectly helping all of us. Thomas is also part of our mobile health clinic. Our health clinic provides health care to our homeless and others who otherwise have no access. Our mobile health clinic is currently operating 5 clinics a week, 2 in Marina, 1 at the Veterans Transition Center and another at Walmart, 2 in Monterey at the Gathering for Women and at Monterey Peninsula College, and a 5th clinic at Walgreens in Seaside. This mobile health clinic has served over 1,000 people since the clinic launched about a year ago. These are patients who would otherwise have no access to care, and the clinic is now providing them with critical access. There are many others in our community who do have physicians, and they do have access to care, but nevertheless, they have difficulty managing their chronic conditions: high blood pressure, diabetes, congestive heart failure, and the like. For them, we have care coordinators stationed on the bridge. Our care coordinators help patients address difficulties that they're encountering: difficulty finding an appointment, securing insurance, getting rides to their medical appointments, or mail-order prescriptions. Sometimes, just a call with a friendly, kind, encouraging voice is all it takes for someone to prevent someone from falling back in the river. Our Montage Health Bridge also has elements directed specifically at our younger members of our community. Last year at this meeting, we announced our plans to create Ohana, a child and adolescent mental health program, thanks to the generous and transformational gift from Bertie Bialek Elliott. This fall, through a national search, we found just the person to bring Ohana to life, Dr. Susan Swick. Some of you have met her and know we're in great hands. Dr. Swick is innovative, inspiring, and accessible. She's been meeting with stakeholders, assessing the current landscape of resources that are available, and laying the groundwork for future clinical programs, which will launch later this year. We're also connecting with kids at school through Kids Eat Right and our pediatric wellness coaches. These free-of-charge programs teach diet and lifestyle to kids and their parents in an effort to combat obesity and diabetes. Our bridge also connects us with other entities in our community to focus on really big issues like diabetes and prescription drug abuse. We're partnering with Salinas Valley Memorial Health System and others to reduce diabetes and prediabetes in Monterey County, where rates are truly staggering. And when it comes to prescription drug abuse, I think we're all familiar with the national opioid epidemic. Our own local power duo, Dr. Reb Close and Dr. Casey Grover, decided to do something about the opioid crisis right here where we live. They're leading Prescribe Safe, a county-wide initiative to address the opioid crisis from every angle, from a reduction in the prescribing of opioids to providing alternative therapies for pain, to arming our public safety workers, police and firemen, with naloxone to address and intervene in overdoses in a life-saving manner. And our efforts are paying off. Deaths are down dramatically in Monterey County, now among the lowest in California. And soon you'll be hearing more about a new joint venture that we've partnered with Salinas Valley and Taylor Farms called Blue Zones. Blue Zones have studied 5 unique places throughout the world where there's an unusually high number of individuals who live past the age of 100. Places as disparate as Okinawa and Loma Linda, California, and Sardinia. So how do they do it? And what lessons can we take locally to improve our lifestyle and our health in our community? We know a key element to staying healthy is access to care, and we've been actively addressing that for over a decade. One of our first ventures outside the 4 walls of our hospital was the development of a primary care and specialty practice known as Montage Medical Group to meet a demonstrated community need. Key to the success of Montage Medical Group has been the recruitment of a talented team of physicians. Physicians like Dr. David Strafacci, who was the first internist hired at Montage Medical Group in Carmel when we opened its doors in 2009. Over the past decade, we've grown to 58 physicians and 5 offices. It's an impressive group of experienced physicians and talented newcomers. Physicians like Dr. Martha Blum, an infectious disease specialist from Cornell. One of our newer additions, Dr. Stephen Fowler, a cardiac arrhythmia specialist who joins us from NYU. And Dr. Nina Similchuk, who's a local physician returning to her roots. In fact, her grandfather is longtime mayor, Mayor Dan Albert. For the first time in many years, through our successful recruitment, we're able to offer openings. There are now openings for primary care at several Montage Medical Group locations. Still, recruiting physicians is a challenge. Many new grads can receive up to 100 job offers right out of school. Pretty amazing. So how do we compete? Well, our metaphorical bridge now also includes housing. Again, a bit unexpected for a hospital. Early last year, Montage Health bought a 32-unit apartment complex in Monterey for physicians and clinicians in other hard-to-fill positions. This strategy has been so successful that we're adding additional housing options to our offerings later this year. So, with all those things, care coordinators, more physicians, social workers, mobile clinics, blue zones, what happens if you still get swept down the river? Well, of course, we still have community hospital here to take care of you, as we have for decades. Even as we build a strong bridge upstream of preventive services, we are always committed to making community hospital the best it can be. Let me share with you several recent enhancements and developments at Community Hospital. We've added around-the-clock availability of UCSF neonatologists in our nursery to care for our youngest patients. We recently earned advanced recertification in 3 clinical areas key to our community: palliative care, inpatient diabetes care, and stroke. Did you know that we average more than 1 stroke a day at Community Hospital, and there were several days in 2018 when we had over 6 strokes in a single day? We're also advancing our skills in our inpatient rehabilitation unit for the treatment of traumatic brain injury. This is made possible thanks in part to the generous support of Bill and Duncan Lewis. When Dr. Bill Lewis arrived on the Central Coast in 1964, he was the only neurosurgeon between Santa Cruz and Santa Barbara. Last year, we renamed the inpatient rehabilitation unit in his honor. As many of you know, earlier this year, we launched a new electronic health record, Epic. Epic links not only all of Montage Health together, but also links Montage Health to other hospitals and systems from across the country. So if you have records from care at Stanford or UCSF or Kaiser or Sutter or Mayo, to name just a few, those records are immediately available to us when you access our system for care. You too have better access through MyChart, a free patient portal. If you haven't already signed up, I'd encourage you to do so. Please stop by one of the tables that's outside in the lobby on your way out, and we have staff to assist you in enrolling in MyChart. Of course, none of the work that we do here at CHOMP or anywhere throughout Montage Health would be possible without our outstanding medical staff. We are so fortunate to have physicians who have served our community for 10, 20, 30, and even 40 years. They bring a collective level of dedication and expertise that translates into truly extraordinary care for our community. So what does all of this mean for you? Well, we never, ever want you to fall off the bridge and get swept down the river. But if you do, we will, as always, be downstream to catch you. Before I introduce our keynote speaker today, I'd like to touch on one last level of clinical care, and that is cancer care, an area where we have excelled for decades. Our Comprehensive Cancer Center is routinely awarded the Outstanding Achievement Award by the American College of Surgeons, and we're always looking to up our game. Our radiation oncology department has installed the latest, most advanced linear accelerator to pinpoint cancer treatment and provide with remarkable accuracy. We're building a new, larger breast care center at Ryan Ranch to meet growing needs and to improve our diagnostic capabilities still further. And our oncologists are increasingly using the power of genomics to guide targeted immunotherapy in our cancer patients. Thanks so much for coming out in the rain today and joining us. Please drive carefully and hope to see you next year. Bye-bye.